All right. Good morning, everyone. I'm Reagan Miller with the Texas Workforce Commission and the chair of the Early Learning Council, and I'm calling the Texas Early Learning Council meeting to order at 11 a.m. Welcome to all of our council members and public who are joining us today. We're producing this as a Zoom webinar, and council members, presenters, and agency staff are participating as panelists. Members of the public are able to participate in listen-only mode. As a reminder, members, keep your devices on mute when you're not speaking. And Megan will also mute participants if needed. Megan Schneider is our Interagency Deputy Director of Early Childhood Support, and she will serve as today's meeting facilitator. And reminder to state your name each time before you speak. I want to remind everyone that since we have several council meetings scheduled specifically on the PDG grant and to hear a lot of information about the needs assessment and strategic plan, we have allowed members the option of designating a representative from their organization to attend if they're unable to. They won't be able to vote, but they can attend. So you may see some new faces. I believe that Dr. Becky Huskeiler has Dr. Amber Brown attending on her behalf. And I believe Kirsten Schwab will be stepping away halfway through and Miriam Mendoza will be replacing her. So thank you to all of the folks who are sending representatives if you're unable to be here, so you're able to keep up with all of our discussions. Public comment. The period to submit written public comment closed at 5 p.m. yesterday. Members of the public are still able to request to provide oral public comment today by emailing your request to Megan Schneider. Megan will put instructions in the Zoom chat if we have anybody attending from the public that would like to provide public comment. And with that, we are going to go to the approval of the June 2023 minutes. You received an email from Megan, or it was attached to the calendar invitation that you received. And I want to see if there are any edits or changes to the June 2023 meeting. Okay, hearing none, is there a motion to approve the draft June 2023 meeting minutes?
Amber Scanlon, so moved.
Thank you, Amber. And do we have a second?
Weldon Beard, second.
Very much well done. With that, I'm going to ask Megan to conduct a roll call vote of all of the Early Learning Council members.
Great, thank you, Reagan. Again, my name is Megan Schneider. I'm the meeting facilitator. Council members, when I call your name, please reply for, against, or abstain. Catherine Abba.
For.
Sarah Abrahams. Weldon Beard.
For.
Terry Breeden.
For.
April Crawford.
For.
Rochelle Daniel. Alferma Giles. Melissa Hoisington.
Abstain due to being absent from that meeting.
Becky Huskeiler. Kim Coffrin.
Abstain as well because I missed it.
Tori Lee. Jerletha McDonald. Reagan Miller.
Or
Maricela Nava. I know I saw Maricela here. Maricela, are you able to unmute?
Megan, she raised her hand. I don't think we can hear you, Maricela.
For. Awesome.
Thank you.
Stephanie Rubin.
Abstain.
Amber Scanlon.
For.
Kirsten Schwab.
For.
June Yeatman.
Abstain. I missed that one.
and Audrey Young. All right. A roll call based on the roll call vote, a quorum is present. With the number of folks abstaining, we didn't get at least 10 members, which is at least the majority to approve. So Reagan, I would propose that we carry this meeting minutes approval to the next meeting, but a quorum is present, and I'll pass the meeting back to you.
That sounds good. And our next agenda item is public comment. And so Megan, I believe we did have some public comment. I'm going to turn it over to you.
Sounds good. So as a reminder for everyone tuning in, there is a section of the Early Learning Texas website that has all of the information about meetings, and you are able to email me at any time leading up to the meeting to have a to share either written or public comments. I didn't get any right now in the first few minutes any additional requests, but we did have one in advance, which is Kara Waddell. So Kara, I'm going to promote you to a panelist, which will take just a second. And while I do that, I'll read the instructions. All right, Kara, you should have just seen that come through, so you should be able to share your video. So Kara, please provide your name, organization, and the agenda topic you're commenting on for the record. You'll be allotted 3 minutes to provide your public comment. When you hear a little chime mark, that means you're at the 2-minute mark. Council members can ask questions after you conclude, and I will pass it to you.
Great. Good morning, members of the Early Learning Council and Chair Miller. Appreciate the chance to offer a little public input. Agenda item is preschool development grant. In terms of, we're thrilled that Texas has this opportunity, and thrilled about the goals and aims that the state is making in it. A couple of comments. For those who don't know, Child Care Associates is a regional nonprofit directly serving in Fort Worth and Tarrant County, pre-K partnerships, Head Start, Early Head Start, and childcare, as well as supporting early educator coaching. We're also a contractor with Tarrant County, as well as North Central Texas Workforce Boards for the scholarship program and most of the quality efforts as well. But the comments I make today are just specific to my role in Child Care Associates. So specifically, I wanted to call out a couple of things in your written comments. There's 3 main buckets or areas. Really coming from the perspective of a local organization. You know, this is a statewide grant, but sometimes it's helpful to hear from the little guys on the ground about how this may impact as well. So the first area is just recognizing that in addition to statewide data needs, there's a lot of local data needs as well. And so recognizing that we'd really love to make sure that local stakeholders are getting reasonable and timely access to data about their community that's collected in their own community. So for example, in the past, if a contractor or a workforce board is collecting data related to its subsidy program, it's somewhat unsure. What is it allowed to share freely? What is it not allowed to share freely? As PIMSA numbers will eventually be given to children in the subsidy system, I know there's a lot of interest at the local level about being able to track with parent permission to make sure that those children are showing up ready for school. And so those are things that we hope to get clarity on. A second area is really talking about the early childhood workforce. We feel it on the ground, and we're thrilled at the recent report that's come out, some of the recommendations being followed on, but we also wanted to comment that we think a critical and important first step is also projecting the ECE workforce that we need. How many? Texas just went through this to identify K-12 educators. How many are needed? How short are we? Do we have programs large enough and big enough to be able to produce those? We think a similar exercise is important statewide, as well as perhaps even empowering local workforce boards in areas to begin to do that count as well. We're a growing state. I know just in our own area, we're booming. And so to make sure that we have the early educators we need is important. And the last area is just talking a little bit about grants and contracts. I know the federal government is looking a little bit at maybe even requiring states to use grants and contracts in the future. And so we just wanted to comment that we would love to get the chance in the future to share with you all about an innovative pilot in Tarrant County that's helping expand access to high quality programs in our community. And that's it. Thanks for the chance to weigh in.
All right. Thank you, Karen. Thanks for providing detailed written comments. We appreciate it. Members, questions? Stephanie.
Hey, Kara. Hi, everyone. So I just wanted to ask quickly about the new project you mentioned, but didn't go into detail, which I think is ARPA funded, but maybe you could give us a little background about that and what outcomes you are hoping to see, come to fruition from that project. And then part 3, I guess, is if you've been thinking about implications maybe for other communities. Obviously not every community is like Tarrant County. So, thinking about other communities and potential lessons, what have you been thinking about with that pilot? Because it's pretty exciting. So, and thank you for working on it.
Yeah, absolutely. It is a local funded, an ARPA funded, so it's regional funding that came to the county that funded a pilot specific to a cohort of Texas Rising Star 4 programs, both home-based and center-based, and beginning to look at how could grants and contracts help offset some of the higher costs of quality in a way different than a voucher only based system, but also perhaps enhancing higher quality programs with grants and contracts. So we've kept TWC briefed informally about this from time to time and gotten their input, and we'll continue to. And we're right at the stage now, we've been in a learning phase. We're just going to the execution of contracts. We finalized a new methodology and sort of formula for doing that in partnership with Texas Policy Lab. We're working with Southern Methodist University also now on being able to evaluate what's happening in those programs. So AIMS, second part of the question, was kind of like, what are you hoping to do with this? Very practically, we are requiring a minimum of $18 an hour for early educators in those classrooms. So we've worked with the providers to help identify like what kind of offset would be needed in order to have the program receive that money. We're not paying individuals directly. We're offsetting costs for the program so that they are able to then set wages and compensation according to degrees, experiences, credentials for those educators. It's also helping to offset some of the fixed costs of the program so that ideally it's more stable, less workforce turnover. And there's also a basket in the methodology for incentives. And so we're looking to try to incent fuller enrollment. There's a fuller enrollment offset that's higher for infants and toddlers than it is for just a standard maybe preschool enrollment. And it's also trying to help ensure that children with special needs would have an additional offset to help cover some of the special needs and costs that come with that, and maybe even helping cover the costs of childcare for those employed at the child care center. So we're still doing the final tweaks on the methodology and the cost, but it's an exciting step forward to consider how direct service dollars in CCDF may or may not, I think the federal government's looking at this now as well, but how those may or may not be able to be used in a voucher-based system, which we're familiar with today, but also perhaps in enhancement of grants and contracts. Did I answer all 3, Stephanie?
I think so. No, that's great.
Okay.
Thank you, Kara.
Sure.
All right. And Amber.
Hi, thanks. Yeah, I don't have any questions, just more comments. I think it's, Kara, thank you so much for joining. Tarrant County is my home county where I live, and I just really want to compliment you and Child Care Associates for the innovation that you're providing in the research and the infrastructure. And it's so labor intensive and thoughtful, and I think it's a true demonstration of how difficult it is to actually execute high quality early childhood education. And if you compare it to the K-12 system, where there's so many built-in layers of infrastructure and funding and support, and you're just doing a tremendous job leading this effort in Tarrant County. And if it wasn't for CCA, what would early childhood education look like in Tarrant County? So I would just really compliment you and really just hope that the council really understands this does not exist everywhere in the state of Texas. And what y'all are doing for infants and toddlers is just tremendous. And the way that you partner with the county and the city and other municipal and state organizations is really great, but it's also really hard. And I think that speaks to the opportunity, but also to the disadvantages of other infants and toddlers in the state of Texas that don't have this setup across the state. It's unique, it's rare. I compliment you and can only hope that there continues to be more work, investment, and infrastructure by the state of Texas and our governing organizations to have this executed across the state of Texas for all young children. So really kudos to y'all for the hard work that you're doing.
Thank you, Amber.
All right. And Jerlitha.
Hi, Jalita McDonald, ADFW Childcare, and I want to echo Amber and just say that how fantastic the program is. I know several family childcare business owners and center owners who are part of the program, and every time they leave one of the workshops, they're beaming with excitement and innovation. So I just want to say kudos to childcare associates in Tarrant County for leading the way on innovation. So that's all I had to say.
Thank you, Julie.
Right, council members, any other questions or comments? Okay, Kara, thank you very much for joining us. All right, so our next agenda item in the bulk of our meeting is on the PDG birth through 5 needs assessment findings and a presentation on the second area that they're looking at, which is early childhood coalitions. So as you all know, Dr. Dorothy Mandel and her team are conducting this needs assessment work in 4 phases with a report out for each of the phases. We did the first phase on the workforce on June 30th, and that is posted on our Texas Early Learning Council website meetings page. So folks are able to go see that there. And today, Dr. Mandel is going to share more details about the initial findings on the second phase of the needs assessment, which is focused on early childhood coalitions. Dr. Mandel.
Thank you. Megan, I'm going to go ahead and start sharing screen. All right, excellent. So we're going to talk about coalitions today. That has been the major focus of that's going to be the complete focus of the work that we're going to be talking about today, as was stated. So I want to go back to remind the council of our needs assessment framework that we're utilizing, because this needs assessment framework is really important for understanding why and what we are measuring through the needs assessment and how we hope to put everything together in that final report. So this is our needs assessment framework. We are looking at program boundary spanning entities and infrastructure and subsystems. And through all of this, we know that it leads to an effective early learning system. And that effective early learning system has lots of different qualities, including thoughtful engagement and meaningful engagement of families, which ultimately leads to family and child well-being, which we know ultimately is associated with school readiness. So our focus today is going to be on coalitions. So coalitions in this needs assessment focus really focus on these program and boundary spanning entities, the connections between education, health, nutrition, social services. But also we are seeing that the coalitions are an important place for family and community engagement. And also that's where the linkages across programs exist. So that's how our coalitions work within this entire framework and where we're focused with coalitions in our framework. So there's always the question about why do you want to encourage local early childhood coalitions? And this is just a conceptualization of what a framework, what a landscape might look like in a local community where you have an organization who's doing WIC, you have an organization who's doing parenting support, a different organization doing ECI, then we have the multiple childcare and early learning systems, lots of pediatric organizations within the community, and hopefully maybe some family resource centers. A lot of the landscape that we're looking at is what we fear is these aren't very well connected. So the first step of an early childhood coalition is actually to build the connections between these local organizations and these local entities to make sure that they're actually talking to each other and they're actually connected to each other in some important, meaningful way. But that is the first step of a coalition and the early childhood coalitions. Ultimately, the most mature situation we would like to see is this, where all of these entities are actually completely connected and touching each other. There is, for a family and for a local on the ground, there doesn't feel like that there's a lot of disconnect between going into WIC or finding early child care, or finding parenting support, that they're not just connected, they're actually working together. They're touching, they're importantly involved with each other. And that's what we want out of the most mature looking early childhood coalition. So why do we encourage them? Is because, well, the literature is pretty good on this, is that coalitions, no matter what they're doing, do a better job at it. So when we look at the literature around just general coalitions, it hasn't been found that there's a lot of difference in any of their health promotion work that they're doing, as far as this type of health promotion is better for coalitions than this type of health promotion, for example, or this type of education promotion is better than this type of education component. That we don't see in coalitions. What we really see is when you have a coalition doing that, it does better. When you have a coalition doing this, it just does better. And so the literature has shown that early childhood coalitions, and just coalitions in general, just can do a lot to improve family well-being, improve child health, and improve school readiness. And this has been seen throughout in the public health space. There's a lot of literature around coalitions, and this has been shown very clearly across that literature, is that these interorganizational networks is one of the most promising ways to attain resources, share knowledge, and in turn, improve population health outcomes. And this comes from Denise Varda's work, who's one of the pioneers in understanding what makes a coalition work well. So that's important. We're not going to focus in this about what the coalitions are doing. What we want to do is focus in this needs assessment is, do we have well-functioning coalitions? Because the literature is clear, that's what we need. We just need well-functioning coalitions, not they need to do X, Y, or Z. So that's what we want to focus on today. There's also really strong literature around what makes a strong coalition. And some of these things we're not going to talk about today, because I think that there's plenty of data in Texas around some of these issues. For example, connections and trust. We know very well from work that has been done with Help Me Grow, as well as some work that has been done by Thrive, as well as work that just across time and space that have been done around early childhood coalitions. These coalitions are built on trust. They have really good connections and really strong connections between these organizations. Most of the time, these coalitions were built because the trust already existed. So we're not going to go into issues of trust within our coalitions today. But the other thing that does come up in the literature around what makes a strong coalition, that's what we're going to talk about. For example, there's a very strong literature saying if there's governance and bylaws associated with a coalition, those coalitions, this is considered a necessary component of sustainability. The other literature that is really interesting is about shared leadership. So oftentimes we think of a coalition having a very strong center and a very strong backbone, which it also needs. But the literature also shows that when that leadership is shared across members and dispersed across members in a really thoughtful and governance-driven way, that also leads to sustainability. Because if, for example, the backbone organization falls down, you need somebody else there to pick up the whole coalition. It can just transfer over to a different backbone. The other thing that's come out of the literature, especially recently, is about resource contribution and how much the members of the coalition are also contributing resources. The other thing that's fundamental to coalitions are shared understanding of data. A lot of that comes into that connections and trust and why you're there in the first place. but shared understanding of data, that helps the coalition move in the same direction together by having that shared understanding of data. We also see that organizational diversity of collaborators are of course important, and we're not going to be talking about that today. I'm just going to show you in a slide very, very quickly that there is a great organizational diversity among the early childhood coalitions. But the other thing that's not in the literature, but we know from our coalitions that they want to become family-centered, that they feel like having the coalition work itself and having the coalition itself be family-centered or family involved is important for their strength. So we want to bring that, we brought that into the needs assessment work as well. So what do we know about early childhood coalitions in Texas? So there's been a lot of work around early childhood coalitions. And so I don't want to undo any of that work. The work that has been done for those coalitions who are on the track for Help Me Grow, they do a lot of internal assessments, especially on trust and connections. And so from that work, as well as from work that we have seen that came from Build, and also additional work that Thrive has been doing through DSHS, there is great trust in most coalitions. Like I don't feel like I need to walk into a coalition and ask organizations if they trust each other. These trust metrics that we're seeing coming out of Help Me Grow are very, very high, and there's not much you can do about that. Just let it be good. But what we also know is they're struggling with funding. They don't know how to fund the actual coalition. The members may be funded, but the coalition itself and funding the work of the coalition has been a struggle for a lot of our coalitions in the early childhood space. So the other thing is they really, really want these family-centered experiences, and they want to be relevant to their community. And bringing in the family voice is the way that they identify that they can be more relevant to their community. The other thing that we have seen, and this is through our work analyzing quarterly reports coming from prevention and early intervention, especially in the MCV programs, where MCV funded home visiting programs are required to be a part of coalitions. Other funding structures within PEI also require early coalition involvement. And so from their quarterly reports, we can really see like how the operations of the coalition have changed. And one thing that's very clear is COVID massively impacted some of these coalitions to the point that they're just now starting to recover again. Whereas other coalitions remained very strong and stable even through COVID, and were able to pivot and respond very effectively during COVID. So the impact of COVID on these have been really, really varied across their operations. So that's what we know about the coalitions. What we don't know is really fundamental, and that is how many there are. And unfortunately, I can't answer that question for you today either. We're still delving into this. And I'll tell you what we think, but we're still delving into understanding how many there really are and how many are active. The other thing that's not sure is how funds are feeding into the coalition work versus the work of the member organizations. So you have a member organization over here that says, I'm doing X, Y, and Z, and we want to connect to you. That's not really coalition work. That's more just connected work. And so we don't know how the funds are feeding the core of the coalition work versus just the member organizations connecting to each other a little bit better. And the other thing we don't know, which we're going to address today, is whether they are functioning in an evidence-based manner. Like I said, the literature is pretty clear. If you have a well-functioning coalition, whatever they do, they're going to do it well. But that structure needs to be evidence-based and adhere to evidence. What we see in the literature is evidence for a high-functioning coalition. So that's what we're going to focus on today. So what was our approach that we took in the needs assessment? Like I said, we don't know how many coalitions there are. So we got a list of potential coalitions who are identified from state agencies, specifically from prevention and early intervention, and also from DSHS's Help Me Grow work. which overlapped dramatically. But we also did some internet searches to see if we can find additional coalitions out there who may be active. And we did find a few through these internet searches as well. So what we did is we first reached out to the lead backbone agency and we invited them to complete a survey. This survey was specific to backbone agencies. Nobody else answered these questions. They were about their governance structure, their leadership structure, whether or not they utilize family advisory boards. And what we also asked them to do was share with us a list of their coalition members, which excitingly a lot of them did. We then took that list of coalition members and took one person from each organization, which got a little tricky sometimes, but one person from each organization. And we sent that person a survey, and they completed the membership section of the survey. And the membership section of the survey focused on how members shared data, what their idea of governance was, how they viewed governance, whether or not how that organization helped share resources with the larger coalition, and whether or not they had gone through family involvement training, and how that then translated into work that was being done in the coalition. So the data we're presenting today looks like this. We have 17 coalitions that we have identified and have gotten back to us so far. We just got another coalition rolling in, so this is still open. But we have 17 coalitions. All areas of the state have been covered except for El Paso. We did not get any coalitions from El Paso. I'm from far West Texas, so I don't think the Panhandle is West Texas, sorry. The Panhandle is represented, but that El Paso area is not. All coalitions are active and completed at least one community event in the past year of these 17 coalitions. So these aren't dormant coalitions. These are all active coalitions. I won't say highly, but they're all active coalitions who have done one event in the community this year. The size of these coalitions varied greatly between really small ones. In the literature, I'm going to say that the size of these coalitions all are considered large. Most coalitions in the literature are between 10 and 15 organizations, and we're looking at organization sizes between 25 and over 80 organizations, and some of our really large coalitions. So these are all considered large coalitions, even the ones that are serving rural areas in our community. In our data, so we have these 17 coalitions, and then from that produced 136 different organizations who provided data for us on the membership survey. And these organizations are represented in this table on the right. So we actually have representation from pretty much every organization that we looked at and identified should probably be in an early childhood coalition. So we have data spanning the entire breadth of the EC landscape. These data have a lot of home visitors in them, which isn't surprising because home visitors in the state are required to be a part of coalitions. And then we have a lot of people who identified other. A lot of our organizations also checked more than one of these. So if you add these up, or you guys are doing mental arithmetic, this is not going to add up to 136 because many of the members said that they were involved in more than one of these sectors. So let's get into the data. Let's first talk about our backbone agencies. So this comes from that leadership survey that we sent out that is really focused on governance and the use of family advisory boards. So one of the things you need to start off with a coalition is you need to have a mission statement. And almost all of the coalition said that they had a mission statement. The one coalition that said that they didn't have a mission statement, they also wrote to me and said that they're developing the mission statement right now. They actually just got rid of their mission statement and they're starting a new one. So she didn't feel like she could say they had one. So everyone's working from a common mission, which is great. But when you get into these more mature parts of the mature parts of governance and shared work, that's where we start seeing that the coalitions need a little bit more help. So only 76% said that they had a strategic plan. And that leaves like 23% who didn't have a strategic plan. When we ask them if they have a charter or bylaws, so that's the governance structure over what the coalition is doing, what the expectations for the members are, what resources are being shared, and how disputes and other things are going to be resolved. Over half of the coalition say that they did not have a charter or they did not have bylaws to help guide the governance of the coalition. There is now 70% of the coalition said that they had a paid staff dedicated to the coalition. And this survey came out right when PEI was pushing out the grants that help fund coalition work. So we actually found out that some of them are like, as of yesterday, we have a funded position. So this percent is a new percent. Some of these coalitions answered this before PEI pushed out those grants, but some of them have been after PEI pushed out those grants. But that has raised what we were estimating before of how many paid staff there are dedicated to the coalition. So that's a really positive thing. Now, when we look at the leadership structure of the coalition, 94% said that the organization, there's a single organization that provides all administrative support for the coalition. And this is not surprising. This is what we would expect out of being in a backbone kind of framework for the coalition. When we asked them if the leadership of the coalition changes on a predetermined timeline, it's clear that also the majority of coalitions do not change their leadership structure or have thought about changing their leadership structure. One organization, if we asked them if one organization leads the execution of the strategic plan and the other organizations serve it as advisor, we asked them how true that statement was. And 64% said that that is how they function. I want to point out and kind of hover on this a little bit, because if one organization is just executing the strategic plan and everybody is serving as advisors, it does beg the question about what the coalition's work is and what the coalition is doing, rather than if these are actually central advisory boards and community level advisory boards. It is okay for them to be community level advisory boards if that's what's working for the community. But it does ask the question of whether or not that model is a model that is it's not the model that we see in the literature related to what makes strong and sustainable coalitions. Let me just put it that way. So the other thing that we asked is whether the leadership of the coalition is formally shared through a leadership committee or some other committee. And we have 30% of the coalitions who said yes, they do. In fact, 2 of them I know they did because they called me and asked me who should do this survey, explaining their leadership structure to me. So that's great, with 30% of them saying yes. 60% of the coalitions actually didn't answer this question. And that's because we think they don't know what that means. Or they're working towards it, or they're thinking through it, or they have to rethink this, whether or not they're in this community advisory board situation, or if they're in a coalition structure. But we did see that a lot of people didn't answer this question. But anybody who actually had a leadership council, they did affirmatively ask this question. Now, the other thing that we wanted to ask these backbone agencies was about their use of family advisors. Because in Build, as well as in Help Me Grow, as well as just my general conversations with coalitions as well, is people would like to bring in family voice. So how are they starting to move towards that? And this is hard to do. This is really, really hard to do. But a lot of coalitions have already figured out how they're going to move towards this and have started moving towards bringing in family advisory boards. So we see that about 42% of the coalitions have identified that they are setting up family advisory boards. But importantly, over 60% of the coalitions said they had some access to families, even if they hadn't started down the road of setting up a family advisory board specifically for the coalition. So that's really good that is part of setting up, going down that road to setting up family advisors. It's just getting access to families somehow, some way through another member organization. And we see that actually that's how they're getting them. So when we asked them if they used family advisors from other member organizations, the vast majority, over 60, almost 70% of them said that they used family advisors from other member organizations. So this is including the ones who are setting up family advisory boards. There's many different ways that coalitions are very creatively trying to bring in that family voice. One of the things that we see that the coalitions are doing is heavily relying on their direct care staff for understanding families' needs. So over 80% of our coalitions said that they really rely on the direct care staff who are in their member organizations to understand the family needs. When we ask them more formal information about how they're formally engaging families, like if they're conducting surveys or interviews with more than 10 families, the exact question is, you have conducted a survey or an interview with more than 10 families in the past year. We see that less than 60% of them have done this. And we're going to go back to this because this is this ability to do surveys and interviews. This has been identified by the coalitions as a need, as a broader, bigger need that they see related to advancing their coalition. But the majority of coalitions, vast majority of coalitions, are seeking feedback from family on their events. So at least when they do events, they're asking families, did you like this? Was this working? We didn't ask them what they're asking, but I'm guessing that's what they're asking. So they are looking for feedback from families whenever they do a coalition event. All right, I want to stop there because we're going to now go into our member survey, but I want to start up there because I did see quite a few faces kind of peek up when we talked about some of these data. Does anybody have any questions or comments? Yes, Stephanie.
Hi, Dorothy. Gosh, I've been working in coalitions for such a long time, and it's a constant learning process. So I love that there's a way for a data brilliant person like yourself to try to collect data on how they function, because as a participant, it's sort of like you always hope you're in a high functioning one, but there's always opportunity to get better. But I guess my questions for you are, one, when you talk about funding for a backbone, do you get, I know, is there sustainable funding for it? The PEI grants might be 1 year, obviously philanthropy can play a really important role. There could be other grant funding that can come, but it's really hard to pay for a staff person to be the funded backbone if there's maybe just a year of promised funding. So that's one, is there a way to figure out whether, how kind of the extent to which there's multi-year funding for coalitions, and how much does that matter? And then my other question is, you have this terminology like high functioning coalitions, and you've talked about, what are the elements of it, But in terms of outputs, outcomes, like how do you see measuring the impact of a good coalition on change, on education? I mean, they all have different focus areas, but what's your thinking about that?
Those are all excellent questions, as always, Stephanie. I'm going to talk about the funding at the end because the member organizations actually talked specifically about funding structures being the problem. Because okay, spoiler alert, when all the money is piped into the backbone agency,
Yeah.
resource distribution doesn't happen. So one of the things that has come out of the literature is everybody needs a little hand in the pot. Otherwise, they're not invested. They're not.
I 100% agree with you. And
So,
I mean, that's a big lesson learned over time is
yeah.
you go to listen, but you don't necessarily participate. You don't
Well, you
agree
become
to
the
take on the
advisor
work.
to the backbone agency for executing the
Exactly.
contract.
Right. I know sometimes it seems easy to just fund a backbone position and then like you're sort of done, but there is a movement to, of course, subgrant and have more shared responsibility that comes with shared funding. So that's good.
Yeah, definitely. And I think the member organizations in particular talked about that is not necessarily the funding, is the funding structure that is that's the problem. So nobody has skin in the game. And if you don't have skin in the game, then your organization will always pull you in a different direction where they do have skin in the game.
Right.
So,
let me ask one other question, which is about the funding piece. Do you have evidence that the funded coalitions are more likely to be in certain kinds of communities, like, or higher numbers of low-income kids don't? Maybe there isn't philanthropy so active in that community and therefore they're less funded. What's your?
That is the next step that we would like to do, not for the needs assessment, because that's going to be part of the PDG evaluation.
Okay.
Work because so much was PDG activity to move out into those backbones, to also fund the Help Me Grow, to fund readiness, to fund maturity activities that led him down the road to maturity. That's what we definitely want to look at as an evaluation of the PDG activity, not as the needs assessment work. So yes, that is number one on the evaluation list.
Yeah.
There's another thing that you said to Stephanie that I want to go back to, and that is one of the things that we're working on right now related to evaluation with PDG activity is where we think the coalition's activities are going to impact health or school readiness. And so that is going to be us having strategic discussions with each of the coalitions that got funded to talk more in-depthly about what they're doing. Because like I said, the literature shows it doesn't matter what they do, whatever they do is going to be better than if just one organization did it. But we need to understand, us on the evaluation side need to understand the scope of that. So that's definitely something that we are going to be doing on the evaluation.
Okay, great. I mean, the only other thing I would say as one of my lessons over time is that it's really important to be clear about scope and focus, but also as community needs change, is there an ability to be somewhat nimble and like maybe the scope is childcare, but there's some horrendous stuff in the community happening around food insecurity. And so will that coalition be able to incorporate some of that new work as needed, and how does that shift happen? So that's just, I don't know how you measure that sort of nimbleness in balance with, but I mean, focus is important, but we've found lots of coalitions say like, well, this is my lane, so I can't really address that other issue. That's got to be somebody else. And when they're small and underfunded, totally makes sense.
Yeah.
So anyway, it does speak to, and I hope, there are some community leaders and funders who can listen to your presentation at some point about the funding, because it's really important. But I know it's hard to measure impact, and a lot of them want to see exactly what's happening with the money. And it's the more you can, I guess, help elevate some potential indicators, I think that will help them.
Yeah, absolutely. And we're going to get into this a lot more at the end of the presentation. Were there other questions or comments?
Dorothy, this is Kim. I know you said you don't have a handle on the number yet, or if ever, and I don't know if we can ever count every coalition's ever happening in Texas, because some, they just grow organically. Is that going to be part of the final report on that piece, or your best guesstimate, or what's your capacity on that piece?
Yeah, on the final report, we're going to tell you everyone we reached out to. So you'll have an understanding of the crosswalk of how we found them and who they are. And then from that, many of them are our PEI grantees, are a part of those coalitions. And some of them I know are not, they're trying to become active again. They were the ones that were really, a lot of the ones who didn't respond, obviously, who didn't respond to this were the ones who are still trying to re-stand up after COVID.
Yeah.
And so part of the report is going to be the analysis of like the crosswalk with what we see of these are the ones that are existing within PEI. Some of these coalitions are incredibly, like Stephanie said, they're incredibly focused. So there are some coalitions who only are focused on anything that impacts NFP, and that's it.
Mm-hmm.
The coalitions that we see that are related to a different home visiting model, they tend to be a little more inclusive of the bigger neighborhood. We have some coalitions that are just 100% childcare. That is it. And it's only a specific type of childcare. So that's what we're trying to crosswalk in the final report.
And then, like Stephanie, someone who's been in many coalitions and still in part of her life, thinking about the governance, thinking about those things that make them successful. Any recommendations or potential recommendations about how to support coalitions and build them together in a network of how do we learn from each other and know what each other's doing, in that community of practice per se, on what those are and how to be a better coalition?
Yeah, that was definitely asked for by the membership. Without a doubt, definitely asked for by the membership. I think from the data I just showed you, it's technical assistance on how to develop bylaws and charters. It seems like obviously the first step.
Yeah.
In making sure that their bylaws and their charter. I've been through charter development with a couple of different programs. I now require them for all my collaborations because they're painful, but you know what? They get everything out of the way.
Yeah.
But I would have known how to do that, but I went through technical assistance on how to develop one. And I think that is an easy first step of the technical assistance for charter development and bylaw development, because bylaws are a lot more formal, but the charters, that's just a shared understanding document of where we are. And it should be
shared mission and vision. Yeah.
Yes, shared vision, and it should be developed in a shared way. So that's my first bit with this particular part of the data. And many of the memberships actually asked for that, of identified that as a need of what the next step to make their coalition better would be, is some understanding on how they want that technical assistance on taking the coalition to the next step.
Great, thank you.
Yeah. Kirsten?
Thank you. This is really great and much needed research. I'm really thrilled with what you've been able to do. And we worked with the United Ways of Texas to try to do some research around this, and we're happy to provide it. It's a little dated material, but we're happy to provide you with that.
I have
That's
been looking for your report, Kirsten, so I'll reach out to you because I know that you guys have worked on this with United Way, so I'll reach out to you.
Yeah, so I just wanted to say one thing about the funding piece, and we found in that research that you know, those coalitions that have a source of funding, whether it's through a state grant or through some foundation support, seem to be able to sustain their you know, their momentum, their work within different organizations. And so that does seem to be kind of a differentiator between whether a coalition, you know, seems to make it over time. So I wonder if we, you know, if there's a way for us to say more about that or learn more about that. I think that definitely is a important piece of all this.
Absolutely. And that's definitely, like I said, a major part of the evaluation. Because there's also the part that I want to differentiate about sustaining the backbone agency's work to administratively support the coalition versus that led to specific activities that the coalition did together. Because we know that the funding will help sustain the backbone agency. So it's an interesting balance in the literature when it comes to coalition work versus the work of the individual member organizations that may be done, you know, like, hey, we're connected now, but not really brought together in that picture I showed at the end where they're really like this. And we want to see what can get them to this as opposed to just connected.
So we're part of a national organization called the Campaign for Grade Level Reading. And one of the criteria that they've created now for coalitions is that they have some funding source and they're able to identify what that is. So I definitely just echo what you said, and that is that it's a really important piece of data.
Stephanie, I saw you came off mute.
Oh, I was just going to add to the point about training and community of practice. Kim's really good point, which is also facilitation. You know, not everybody who wants to, it's hard to be the backbone project manager, and not everyone gets that kind of training in their job. So, you know, to the extent communities, philanthropy, and others can offer that kind of project management training, facilitation, liberating structures, you know, ways to engage people would be great. I have to say, just as an aside, the first coalition I joined was in California, and it was a child care coalition. I think Kim probably knows who I'm talking about, but I was part of a new group, and the coalition said, no, thanks. We don't really want anybody else. And, you know, it took some time. So in addition to bylaws and charters, there's also like how do we function? What are the rules of operation? How do we operate in a, you know, open, transparent, like welcoming everybody's opinion? And yes, Dorothy, we want to operate in this, you know, lockstep way, ideally, but there's going to be conflict. Too. And so, you know, rules of operations I don't know that I've ever been in a coalition that had bylaws, maybe, but there's more like kind of rules of operation and like an agreement of how to engage in it beforehand, that I think if everyone votes on it and talks about it, then it's much, much better.
Yeah, definitely. And it, like I said, when we get to the requests by the members, this kind of facilitation this is really what the members are also asking for. So that, yes.
And there are some good resources out there on those good rules of engagement. I know I've collected some over time, so if anybody's interested in any of those, they can.
Yeah, definitely. And there's really good resources out there too which is one of the things about charters versus bylaws, is charters are a lot more fluid. They're living documents. They're supposed to be living documents. And that was one of the reasons why we asked about charters. They're the rules of engagement and also the expectations and the pressures on each of the organizations too, of what and the expectation of contribution. So those can change, and that's the great thing about them. Okay, so we're going to go on to the coalition members. There's a lot of spoilers that just happened, but one of the things that we want to see related to coalitions, as Varda had pointed out in some of her early work, is coalitions are a great way to diffuse knowledge and to share knowledge from organizations down to whoever is receiving, whoever is on the receiving end of that information. And so for early childhood coalitions, that's families. So when we asked members about knowledge sharing and diffusion, the majority of them really said that they have a central place where they actually can share knowledge. They can share their resources, and they can share the resources each member organization gives. Let me back up. Because we have these large coalitions and we have small coalitions, I'm going to tell you right now that we analyze these data separately for large organizations and small organizations to see if there was any difference. And there wasn't any difference in anything I am showing you except for this. And we think that this is there's a couple of things at play here with this particular difference between large and small organizations. So when we ask the members if their organization regularly shares referrals, their organization shares referrals and resources with the rest of the coalition, large coalitions are less likely to say they do this. Members of large organizations are less likely to say they're going to do this. Members of small and mid-sized organizations are much more likely to say that they do this. This could be one of two things. One, because I know two of you are on very large coalitions, is because in these large coalitions, it's not just direct care providers on the organizations. In the coalitions, it's also philanthropy and advocacy and business who are on these coalitions, who are in these coalitions. In the mid and small size organizations, we really see direct providers. So they're more likely to share resources. It could be that. The other thing that it could be is these large coalitions, many of them are heading down the line of help me grow. So a couple of them actually already have a centralized database. So they're like, why do I need to share more? So there could be a couple of things that are leading to this difference about sharing. And this is one of those things. Now that I have the data, I wish I asked this question differently. But we'll get into that. We'll break this up when we get into the evaluation of how the coalitions are working. Now, this is one of those evidence-based things that we want to see. We want to see members contributing to the functioning of the coalition. That is clear in the evidence, the literature about well-functioning sustainable organizations is whether membership is actually contributing. And there's a couple of different ways that membership can contribute. They can contribute in material ways. And we see that actually we have very low contribution from member organizations materially to the coalition. So they're less than 40% across the board use their own funding for coalition activities, contribute to grants that are going to help fund the coalition, or provide in-kind support to the coalition's activities. So these are like really directed material contributions. The material contributions that most coalition members give is time of their staff. So that the staff are paid to attend coalition meetings. We have a few where the staff volunteer their time. We know in some organizations there are volunteers that go into the coalition. But when we look at material contribution, the biggest material contribution is just staff time. I don't want to say just because that's important, but it is these other parts that we see that are for material contributions aren't necessarily there. The other way that coalitions can contribute and disperse resources is through expertise sharing. And that's also incredibly important. We have very few members who said that they actually facilitate if the lead agency can't be involved in the coalition, like they have a conflict maybe for that meeting, or they have a conflict associated with the subcommittee or whatever. Very few agencies said that they would, very few of the members actually said they would step in for the lead agency. We do have a good representation. This is actually really good representation of healthcare experience and expertise represented on our coalition. We only did health and other related to expertise here. And then majority, of course, are providing other expertise, which just means not health related expertise. We also asked them about some other things that are sticking points with coalitions about contributions. One of the things we asked them about whether they contribute any data resources to the coalition, and 60% actually said they did. And we think that a lot of this data resources that they're contributing is sharing data, aggregate data. Any of the Help Me Grow organizations had to answer yes, did answer yes to this. If the members are actually a part of that Help Me Grow network, they answered yes to this question because that's a requirement of the Help Me Grow framework. But there's still room for improvement when it comes to these resource contributions related to data. The majority of coalition members said that they provide feedback and contribute community connections. And that's really where they see their contribution related to the coalition membership and what their role as a member is on the coalition. So again, the funded aspects, really low contribution, the expertise, connections, and community voice part is really where the high contribution is. Related to the coalition members. So the next thing we wanted to talk about was diffusion and cooperation. And this is really focused on family diffusion and then cooperation among members. One of the things that we see is that we asked them if they provide information to families in our organization that we receive from the coalition. So we pass coalition information on to families. And that's 80% said, yes, they do that most of the time. When we asked them whether they coordinate their activities with at least one other partner, they're actually saying they're doing this at a really high rate as well. So that connected part exists within these coalitions. It's the coming together part, the melding part that may not be all the way there with the coalitions, but there are definitely at least some members are collaborating with each other, whether those collaborations existed before the coalition or came around and arose from the coalition. Again, that is something we can talk about adding into the evaluation framework. So one of the big things that coalitions want to do is do more for families and bringing families in. And so we spent some time in this survey with member organizations to specifically talk about a family engaging training that actually is available for free and has been pushed out by PEI. And that is the National Family Support Network Quality of Standards. I just received another notification yesterday that a new cohort is coming through and would I like to join this cohort. And PEI is paying for this facilitation. This facilitation is free. We only found 19 of the 136 member organizations said that they have actually gone through this training. And when we asked them about if they're diffusing that training through their coalition, that's also where it gets pretty low. So of the 19 organizations, they are represented only in 7 coalitions. So that does mean we have a couple of coalitions where the member organizations are going through it together, which is great. That's kind of what we wanted to see happening. But in the vast majority of the cases, not the vast majority, but in the majority of the cases, they're actually going through it on their own. What we see is when we ask them if they even discuss the training in coalition meetings, only half of them said that they discussed this. So as their organization is going through this family training, they're not necessarily diffusing that training through their coalition in this example. of this particular training. And we focused on this particular training because it's in the PDG grant, and it's also training that we know that PEI has been pushing out. So these higher level trainings, that's where we're not seeing the level of diffusion through the coalition that we would kind of hope to see. So when we asked also these member organizations about family inclusive activities, and one of the things that I want to point out is there was huge variation even within the coalitions on how members interpreted whether or not they're being family focused or not. Within the same coalition, some people said, yeah, we do a great job of this, and other people were like, no, we're not doing a very good job of this at all. So even within the coalition on the family inclusiveness, there's conflict within the coalition about whether they're being family inclusive or not. So when we asked them if they do things that provide advice on how parents can connect to each other, many of them said that they did. So this was a rating scale from 0 to 4. So this being below 3 reflects that huge variation that I was just talking about that we see even within the coalition related to this. The thing that many people agreed on was that they provided opportunities for the whole family to obtain early childhood information. That one actually really had high agreement even within coalitions. But the other two, providing advice on supporting parents to cope with difficult child behaviors and providing advice on how to connect parents to each other, those two had huge variations within the coalition among members. So they're really agreeing on opportunities for the whole family, but disagreeing on the rest of family inclusive activities. So now we're going to talk about my favorite thing, which is data and the common understanding of data, whether the coalitions are using data to gain a common understanding. And by and large, they are when it comes to community level metrics. So community level metrics, the coalitions and the members highly agree that they were reviewing community level metrics of needs and risks, that they were reviewing these metrics disaggregated by different indicators that were important for that community, and that they share data that shows the reach of coalition activities. So those 3 things they feel like they're doing pretty well on. When we get into what comes next, so do you have enough data to make a decision about priority needs? They disagreed a lot more. Do you have the data that shows the impact of your coalition activities? I'm actually surprised this was as high as it was. But this is one of those ones where some members were really high and a lot of members were really, really low. So there's huge variation in this. And my experience with coalitions is this is also where they're really lacking, is showing the impact of their activities. So if they have adequate data to assess their work, it gets a lot lower. If they share aggregate data about client characteristics, it gets a lot lower. And then the holy grail that is part of the Help Me Grow framework is that they track their clients through member organizations. That's where it gets really low. And for those of you who have ever worked on this, that it is high as 1.5 is probably like, really? I'm surprised you could do that. I did not expect it to be that high. But the more fine grained and local the community data is, the more it becomes a part of the organizations, the harder and harder it is. And this came out in the build work. This comes out every time you talk to a coalition. And one of the things I want to talk about here is the difference between the state providing data versus those organizations figuring out of how to share data locally. And some of these really important things that they're really struggling on actually has to do with those communities really need to figure out how to share data between organizations. There's not a lot that the state can do to help when it comes to some of this data sharing. So with that said, I just want to talk about real quick about how we see divergence from the evidence base. So when we look at strong governance, we've talked about this, there's little use of charters or bylaws. And so that's, to me, one of those easy catches in technical assistance. It's not easy to do it, but there's lots of great technical assistance out there about it. The evidence says we should have dispersed leaderships, and we tend to have coalitions that be centrally driven with few who have leadership sharing. Like I said, there's 3 coalitions that have, like, they all called me together to ask me who should fill it out. So their leadership council is strong and tight. So that might be one of those places of communities of practice of how they built that leadership council and what the leadership council does. The other thing that we're seeing is there's not a really good disbursement of resource contribution. That there's little material resource sharing happening within the coalitions, and the sharing is really focused on expertise. Not to say that the focus shouldn't be on expertise, but it also should be included, bringing in that resource sharing as well. However, I want to point out that there's a lot of places coalitions in Texas are aligned with the evidence base. And we cannot underestimate the trust that exists within the coalitions that led to a lot of this coalition building. There is really good shared understanding of data happening within our coalitions. I can say this personally as I've talked to coalitions about the data, or they've invited me to talk about what is happening in their community and what I see within their community metrics. They just want to go that next step, and that next step is a hard step, but they do have a shared vision of what's happening with their data. And there's really good organizational diversity among the collaborators. Who we think is part of the early childhood landscape is by and large represented in the membership that we got information back from, and also in the membership list that I received. There's a really good organizational diversity. So as much as I'm talking about where they diverge, there's a lot of places they align. So we don't want to talk about that the coalition system is broken. It's just different places that we can find that are important for maturity. And like I said, when we ask the coalition members, not the leadership, but the members, what's the next step? What's the next step you want to take? The technical assistance came up a lot. Like technical assistance about, we just want to bring somebody in who tell us what's the next step. We want to bring somebody in to tell us, like, what does it look like and where do we need to go? How do we need to get there? They want to increase family voice. That has come up several times across multiple iterations of interviewing coalitions. Where the membership also really focused is evaluation support. We received a lot of comments about the need for additional evaluation support. They want to understand their data. They want to develop evaluation frameworks so that they can actually measure impact themselves. Many of them understand that this is the first step that's needed to get into that higher level of philanthropic funding, and to get into the higher level of sustainable funding. So there was a lot of people who asked for evaluation support. And then the other thing that came up from the voice of the members is more investment from the members. And I just have to say that, to me, when we looked at these responses and I looked at the data, I don't have to present these data to the coalition members because I feel like they know what they need. There is nothing that they asked for here that I wouldn't have also recommended based on the data I have. So I'm happy to present it to them just to make them feel like, yeah, I'm right. And here's the data to show it. But they have a lot of really great insight about what they need. And the members have a lot of great insight about what can take the coalition to the next step. And so our observations on what would improve the coalitions, well, everything they said, but also technical assistance around innovation diffusion. We really want those coalitions to work because it makes it easier to diffuse innovation through the early childhood setting if that coalition can do that. That is not an easy thing to do, and having technical assistance around innovation diffusion, I think would be also helpful for the coalitions. And something that I've been talking about for a very long time, and brought up to you, Stephanie, is joint funding. Funding for not just to go into the backbone, but to go and be spread and diffuse through the coalition, so that resource sharing can be increased, because that then increases the work of the coalition to bring them back together, not just to be connected. So to go back to Varda's original quote, it's about attaining resources and sharing knowledge. And that's one of the things where I see that we can also do more to help the coalitions, is help them attain the resources and help them share the knowledge. So I'm going to stop there and then open it up back up for questions and comments. All right, are there any questions?
I've got an easy one.
Yeah.
This is Kim again. Remind us of, I know you're still collecting information. I also know you said you haven't been able to connect with any coalitions in El Paso.
Mhm.
Like, what's the next steps for collecting the data and that whole process again? And writing
Yeah,
it
so we're
in.
still working with a couple of coalitions who have responded about how we can push how we push the survey out through their membership. Because of the way we have it designed to push it out to organizations, not to individuals. And their coalitions actually are really individually driven. And so we're working with them to figure out, like, well, how can we push this out? And also revising my survey a little bit so I can bring in that individual work that is being done in those coalitions, because one of them is actually I'm impressed with some of the work that they put into the memberships and the leadership survey. So I'd like to figure this out. So we're working with them, and then we're also going to do a little bit more directed outreach specifically to El Paso. El Paso is one of those places where we aren't 100% sure who the coalition is. So
Okay.
that's why I'm trying. There's an early childhood coalition in there through UTEP, but that's just childcare focused. So
Mhm.
we're trying to figure out what's going on in El Paso.
Okay.
All right, other questions?
Thank you so much, Dorothy.
Yeah, no problem. All right, I'm gonna stop sharing then. Stephanie, did you have more, or Megan, did you have more? Okay.
So many, but I'll wait.
All right. Dorothy, thank you very much for the updates. All right, so members, our next agenda item are updates. I do want to share with you guys our next steps around PDG. So we just heard on the needs assessment, but our next couple of meetings are in person and they're focused on the strategic plan. So August 16th and October 5th and 6th are the next in-person meetings that we have. And as a reminder, you know, you can send folks if you're unable to attend those are in-person meetings. We are going to send out some homework prior to these strategic planning meetings. We've been conducting webinars about the scope of the grant, the different focus areas of the grant. And the first meeting on August 16th will be covering workforce, and coalition needs. And so there are 2 webinars that have been conducted to provide a general overview of the grant's work in these areas. And we'll be sending you guys links so you can take a look at those. If you weren't able to join those webinars, you can take a look at the recording prior to our meeting. So any questions about that? All right. We do have an update from Megan Young. She's going to talk a little bit about their personnel retention grant. We were just talking about workforce needs. So Megan, happy that you're able to share some updates.
Yeah, thanks so much. And so I also wanted to take a moment before I dive into some of the work that we've done. I had a really great conversation with our early childhood intervention providers yesterday. They were all in Austin for a meeting, and state staff got to join them. We had a really good discussion around some of the workforce needs. And so I wanted to just kind of recap some of the challenges real quick before I dive into the interventions that we're making there. So some of the challenges that we're facing with ECI and workforce relate to the people who are newly entering the workforce. So specifically around whether they receive training in pediatric care in the case of our physical and occupational therapists and our speech language pathologists. And then whether they want to be out in the field to deliver services in the natural environment, which is a requirement of our program. We've also, across the entire state, and especially also within ECI, we've seen a huge population increase in terms of who we need to serve, while the number of people who are entering the workforce, especially the therapist providers, is relatively static. I'm also hearing from our local providers about increased competition for these personnel, with schools and home health agencies, particularly being able to offer certain perks that ECI can't offer, for example, less travel and more time off. And so with that said, I want to highlight some of the efforts we've taken and where we have seen some successes with at a program level. So we're in year 3 right now of the personnel retention grant, which is through the Department of Education's Office of Special Education Programs. And while the overall project, we've looked at all personnel, we have had a great focus on our early intervention specialists and our service coordinator positions, where we had found those to have the highest turnover when we entered into this grant. We partnered with the University of Texas at El Paso to host 2 summits, bringing ECI program directors together to learn about evidence-based retention strategies. And we provided funding for a subset of our programs to go out and implement some of those evidence-based strategies. This grant also supports a few other initiatives. So one is the ECI Leadership Training Summer Series, where we have web-based sessions tailored to retention strategies that our contractors have expressed interest in. So the session topics included mentoring, university partnerships, and personal development. And we also used grant funding to develop and implement what we're calling the Professional Engagement Empowerment Resources, or PEER network. This is for our ECI service coordinators and early intervention specialists. Membership in the PEER network has grown to more than 350 ECI personnel across the state. So it's a community of practice where our early intervention specialists and our service coordinators share knowledge and learn from each other. It's a virtual platform, so our providers in Beaumont can connect with our providers in El Paso, for example, and they can develop leadership skills by facilitating discussions and book studies, and they get to connect and with their peers and build core competencies on topics that have included time management, engaging families, and avoiding burnout. And right now, since we're nearing the end of this 3-year grant, we're working on a co-planning committee with our state staff who have been facilitating and running this, along with 12 volunteers from our peer network, to talk about how we can facilitate, sustain, and further enhance this peer network once our grant period and funding comes to an end. And so our goal is to hand the reins over to the ECI personnel with some ongoing support from state office. And we've really seen some promising results from this work. So when we look at our overall retention rates, we've seen a 3.5% increase since 2020 in retention rate for the staff who participate in the peer network, and staff of all of our ECI programs who participated in our first personnel retention summit in March of 2022. And when you drill down to those programs who received grant funding to implement the evidence-based strategies that they learned about in that summit in March 2022, we saw a 7.4% increase in their retention rates. And also, as I think this group is well aware, with our preschool development grant funding for this year, we've allocated out $400,000 for our local programs to pay stipends for recruitment and retention for therapist positions, as well as for staff who serve as mentors. So what we realize that there are things at our program level that we can do, that we are doing, that our local programs can do and are doing, where we've seen an impact and measurable improvement. But when we talk about workforce, it's really critical for us that we're looking also at the overall environment and whether we have, first, enough people entering the workforce, and two, whether they're receiving appropriate education to serve the early childhood population. Any questions?
Megan, thanks for the update. On TWC side, we actually also fund a staff retention project. We've competitively procured it. Together for Children in Austin is our grantee, and they're really focused on sort of transformative leadership skills at the director level as a mechanism to try to create work environments that are supportive of staff. We've heard great things about the folks who have gone through the program. Clearly, retention in childcare is always a big issue, primarily tied to the pay. So trying to think about how do you retain staff using strategies that are within your control has been something that we've been interested in. Okay, members, anybody else have updates, comments?
I have an update.
Stephanie. Oh, Jurlitha, yes.
Hey guys, I have an update. Recently I was able to participate in in the Office of Child Care Central Region CCDF State Administrators meeting, and Allen providing the closing keynote to child care administrators from different regions. And the focus of that talk was elevating the voice of family child care, early childhood educators. It was really cool. It was good to see all TWC there. And just recently, last week, I participated in the NCQA, the National Quality Assurance of Early Childhood Education's mini conference within the NFACC conference as a speaker, but I was able to bring some early childhood educators with me from Texas to participate on that panel with me, and it was again on elevating the childcare voice. One of those providers were that Kara had mentioned earlier, participants on the Prime pilot. So she got to explain her experience on the Prime pilot and all the amazing things that we have going on in Tarrant County. So my organization is on a mission to elevate all early childhood educators' voice, not just family childcare, but all family childcare educators' voice. And I have a special announcement to make. The National Family Childcare Conference will be held in Dallas, Texas in 2025. It's going to be in St. Louis next year, but I've been really fighting and advocating for it to come to Texas, and it will be in Texas in 2025. That's it.
All right. Thank you, Jurlitha. Stephanie.
Yes, ma'am. So I'm going to share a link to, as we know in Texas, sometimes there's big steps forward and sometimes, challenges that are steps backward or things we have to grapple with. And one of the big ones relates to what's happening with kids and particularly pregnant moms who have received Medicaid coverage for throughout the pandemic, given the pandemic rules. And there's now an unquote unwinding of that process as the extended coverage is now coming to an end. So HHSC has a significant amount of work to try to figure out using information from families and what they have access to through other agencies as to whether kids and moms in particular are still eligible for Medicaid. And the first tranche of data came out from April onwards, and the news is not good. About 500,000 kids have been rolled off of Medicaid. And if you, as we did kind of look through the data provided by HHSC, and the vast majority of those kids have not been deemed ineligible. There just hasn't been confirmation of eligibility. So there've been a number of articles and editorials, and there's a lot of concern about whether what's happening to those kids when they come and show up for an appointment, need their physical to get back to school, need medicine for asthma or whatever, they may confront a lack of coverage and a delay in care. And so there's a number of things that I think, the reason I'm bringing it up as relevant to the Early Learning Council and also the strategic planning is I know we talked about in the application the desire to have an eligibility screener, but one of the things that other states have been doing and that we proposed through legislation HB 1599, and I know there's a lot of agency folks interested in this, is work towards the ability of agencies to accept the eligibility of families into programs based on the fact that they may be enrolled in another program. So for example, if a family is, receives a child care subsidy, we know that TWC and the local workforce board have already, evaluated their eligibility. And if a family may not be responding in the, 10 or 20 days to HHSC on the Medicaid eligibility, there is a process that other states are using to say, hey, they've been approved for SNAP, they've been approved for childcare subsidies, let's assume income eligibility until we can prove otherwise. And that other states have been able to implement and reduce the number of kids that are, kind of kicked off of Medicaid even for a short period. So that's the reason I bring that up is I know from the application that there's interested in eligibility screeners, which would help families figure out, okay, if I'm eligible for childcare subsidy, I may be eligible for something else. A step further would be, agencies using the data they have across agencies to make sure that families who are eligible stay enrolled. We check, obviously at some point you need to check with them and make sure they want to stay enrolled, but that's pretty key to prevent the kind of situation we're in now with 500,000 kids disenrolled from Medicaid. So I shared our statement. There's still lots of discussion with the agency, of course, as to opportunities to address the challenge. There isn't sufficient funding for staff, to start checking millions of enrollees' income. It's very cumbersome. There's also lots of things that communities can do, especially around back to school time, make sure families get information about updating their income, how to get re-enrolled and so forth. So I know HHSC is interested in talking with schools and childcare and others to get the word out. It's obviously an area where philanthropy and other community programs can help. And there are some discussions about whether we should kind of slow down the disenrollment until we can make sure that, families are getting information and that there's supports there to make sure that they know how to to update their income and respond to the letter that comes and so forth. So if anybody has information, anybody needs additional information about this, feel free to contact us at Texans Care for Children. There's a number of other groups obviously watching very closely and involved, and we're talking and with HHSC about ways that we can all be helpful to this process. But I do hope, that we can, as a council, talk a little bit more through this planning process about the importance of health coverage and well-being for kids so that they're successful in childcare, they're school ready, they can have access to ECI, and other services, and not leave the kind of health coverage thing off to the side. And I think, this issue of families losing coverage is really, really significant. Like, it will affect kids' ability to do well in school over time if there are big gaps in their coverage and care. So I will leave it at that, and I welcome any questions off to the side or in the chat. And thank you for the opportunity to give you an update on that.
Yeah, a couple of things I'll say. When you talked about presumptive eligibility, so parents know what they might be eligible for. In the PDG grant, we are looking at an eligibility screener in, I believe it's year 3 of the grant. So that is something that we're hopeful we'll be able to put together. Also wanted to mention on this notion of presumptive eligibility that the Office of Child Care just issued some proposed regulations the end of last week. Public comment is open through August the 28th. One of the areas that they have proposed is that CCDF eligibility, you could use presumptive eligibility from other means tested programs to allow for an initial 3 months of childcare eligibility pending completion of the required paperwork. So it would create an easier entry for folks and not having to get all of that paperwork in place right away before you could initiate childcare. Lots of other stuff in those regulations, but that one was one of those key components.
Great.
I also wanted to come back to staff retention because there were a couple questions in the chat. Want to point out our Austin-based service provider, our grantee, has already selected their service area for their next cohort of training. It's in South Texas somewhere. So they actually received, she told me last week at our Texas Rising Star Conference, they received 600 applications for 100 spaces. So clearly there is a great deal of demand. They are our only grantee at the time. So, when we re-procure, we'll certainly see if there are other entities that can provide this type of transformative leadership training with the goal of retaining staff. But we have a grantee that's, well known, and folks love their work, and it shows in the number of applications that they received. Okay, let me ask if any other members have any questions or comments. Okay, so our next slide is events. We talked about these at our last meeting, so I think these should not be new to anyone. Does anybody else have any events that they want to highlight? Kim.
Reagan, I'd be remiss if I don't mention Texas ARAC's annual conference. It's coming up the first weekend of November. It's at the relatively new Kalahari Resort here in Round Rock. It's actually my backyard. So that registration is open. You can find it on Texas ARAC's website. So so just putting that on the radar. So
thank you, Kim.
Um,
Any other member updates, Jerlitha?
yes, the Tarrant County Workforce Board, Dallas County Workforce, and Central Texas Workforce is hosting a conference for early childhood educators in our area in August. I want to say it's the 3rd week of August.
Thank you, Jerlitha.
You're welcome.
I unfortunately am out of town, but we'll have Allison Wilson and Lindsay Hill attending as well. Thank you for mentioning that.
Yeah.
Kim, thank you for adding that to the chat. All right, I don't see any other hands up. Okay. Well, members, that concludes today's agenda. As I mentioned before, our next meeting, which is focused on strategic planning, is in person, August 16th, 8:30 to 4:30. Really looking forward to seeing folks in person. It's been quite a long time since we've been together, so this will be an exciting meeting. Thank you, Dr. Mandel, for the great presentation today. Kim, you have a hand up.
just making sure I remember this correctly, the location of that meeting is at the TWC building on, or where is that? Or do we know where that's at yet?
Are we finalizing that the hotel at this time, Megan?
Yeah, hi, great question, Kim. The hotel is finalized. We're gonna be sharing out the details next
Okay.
week with all the members, whether you're local or you're traveling in from out of town.
And there's like gonna be a water slide, right? Megan?
Yeah,
Okay.
yeah, that's part
I
of
was
it.
hoping for margaritas, but okay, you can have a water slide. So-
It's August, Kim, in Texas.
All right. Okay. Well, members, thank you again for joining us. And thanks for all you do for our youngest Texans. We will see everybody. We hope to see most everybody August 16th.
Stay
It
cool,
is
everyone.
12:45 and the Texas Early Learning Council meeting is adjourned.